Greetings and welcome to Dougy Dialogues. I'm Dr. Monique Mitchell, and we're webcasting from Dougy Center in Portland, Oregon. Dougy Center, the first childhood bereavement center in the United States, is recognized as an international leader in the childhood bereavement field for supporting children and families who are grieving. In these 30-minute discussions, Dougy Center staff explore language, trends, research, theories, and other relevant topics related to death, dying, loss, and grief. Our intention is to continue to shape the professional dialogue in the field, and we hope to spark some thought-provoking conversations along the way. Dougy Dialogues are primarily intended for an audience of professionals working to support children and families who are grieving. If you're looking for lived experience or support for your own grief, head on over to our Dougy Center podcast, Grief Out Loud, on iTunes or your favorite listening platform. Thanks so much for joining us, and welcome to Dougy Dialogues. Hi, thank you so much for joining us today. I'm Monique Mitchell. I'm the Director of Training and Translational Research at Dougy Center, and I'm also the National Director of the L.Y.G.H.T program, and I'm joined by Alicia.
Hi, I'm Alysha Lacey. I'm the Director of Program Services at Dougy Center.
Thanks, Alicia, for joining me today. I'm really excited to talk to you about the value of community partnerships. And I know we've been talking a lot about that, and just to kind of bring people into the fold about the frame of reference that Alicia and I are going to be talking from today. So for myself, I am as I mentioned, the National Director of the L.Y.G.H.T program, and that's a peer grief support group for youth in the foster care system. And we are currently running that out in South Carolina, hopefully bringing it soon to Oregon. And so I'll be talking about the role of and the value of community partnerships in that particular context.
In my role as Director of Program Services, I'm mostly overseeing our local programs, so our peer grief support groups that we do out of Portland, Oregon, and also virtually right now, but also all of our local partnerships with other nonprofits, really thinking about actually our volunteers and all that they contribute to our services, and other partnerships that we're able to find in the community.
All right. Thanks, Alicia. So I think we started, what was the first topic we said we wanted to kind of just chat about? I think it was, I'm going to look at my notes. Oh, yes, of course. So Alicia and I were just, we don't talk a lot before these Dougy Dialogue episodes because we like it to be natural and authentic in our discussion. But we did highlight just the value of, well, basically, long story short is without our community partners, we would not be able to actually implement our program successfully. And I'll just kind of speak from my part. And then Alicia, if you're good, I'll hand it over to you to talk about from your perspective. So with the L.Y.G.H.T program, this is again, a peer grief support program that is held and run by child welfare agencies or organizations. And so they're trained on our model. They're trained on the Dougy Center model, which has been adapted for a foster care community. And the community partners themselves are the ones who actually implement the program, right? So us as Dougy Center staff, we go out, we train folks, and we provide program support and supervision, but they are the folks who are actually integrated in the community and providing this program to youth in foster care. And so, will be forever grateful and feel just a deep appreciation in my heart for child welfare community partners saying, yes, we know that this is needed. We know that loss and grief is a huge component of the lives of youth in foster care, and we want a program to deliver. And so from that end, it's not unlike what we do here at Dougy Center, and Alicia will talk about that. We're not actually providing the program here. We provide the training, we provide the oversight, but it's our community partners who run it.
Yeah, and it's slightly different here locally, because obviously we are providing the services, and group coordinators, Dougy Center staff are running the groups, but we have so many volunteers that we rely on. Right now we're running 57 groups, and each of those groups we have between 6 and 12 volunteers, just depending on the age groups. And so we really absolutely need the volunteers to create those high adult to child ratios so that kids can get the services they need. And our partners are really the people that send a lot of our volunteers to us. We really could not run groups in the manner that we want to without all of those volunteers giving back. So it's really just astounding the amount that they contribute and how much we get back and are able to run our programs because of that.
Absolutely. And I would say, I imagine too, Alicia, it's, with our volunteers, and then it's just the community organizations also who support like maybe their staff who want to volunteer. I know that when I was running group here locally, we had volunteers and they would speak to their bosses and such and say, I'm volunteering at Dougy Center. And I think also without the support of their bosses who were saying, okay, if you need to leave half an hour early to do this volunteer service, we're supporting you on that. And that's critical too, right? Because it's the larger community system of understanding the impact that our program can have on individuals who are grieving and providing that support as well.
Yeah, absolutely. I'm thinking of a specific volunteer in my group, and she works for a B Corps, and through the B Corps, they have to do a certain number of volunteer hours per month. I think it's maybe 1 or 2. And because she does her group, she actually does 7 hours a month. And she spoke to her boss and said, this is something I'm really passionate about. Here's the mission. This is what's happening. And her boss said, absolutely, like, please keep doing that, make that happen. So it's just really awesome to kind of hear that allowance from other businesses that are in support of our mission as well in that way.
Yeah, absolutely. And you just kind of reminded me of, in the child welfare context. So when people receive the training for the L.Y.G.H.T program, a lot of them are child welfare staff, and they already are working so many hours. And one of the, the resistances sometimes when we're like talking to some of the staff and saying, would you want to be a facilitator? Would you like to be trained? Is, Monique, I would love to, but I'm already working X amount of hours, and I just don't think I can take something on above and beyond what I'm already doing. And I think it's really great because, as we speak to the executive directors of the organizations and we are brainstorming together, what they're doing is saying, okay, let's embed this into their job description. Let's embed this so that these hours that they're putting towards the program are actually part of the services that they're offering. Well, obviously they're part of the services, but part of their job description so that they're not having to work above and beyond. And I think that is just really stellar on the executive director's call, because they're recognizing A, the value of the program delivery, and B, not wanting to overwork staff and saying, how can we accommodate this so that it's within, the hours that they're already providing, and make that basically that accommodation, which is very supportive.
Yeah, that's fabulous. It makes me think also of just the partnerships we have with local colleges and universities and other higher education, where there's students who really want experience working with maybe children and families, or hopefully grief work or group work, and they seek us out to do some volunteer work, and their supervisor kind of oversees that relationship and connecting to us. And we get the benefit of having, again, more volunteers and people working, but we're also able to give them that experience that's so valuable and actually really hard to find. I have so many students who say this is absolutely the work I want to do. And as an undergrad or a grad student, it's really hard to find a placement. And so we're both able to be kind of mutually benefiting from that relationship. And it's a really fabulous learning opportunity for them, and a great advantage for us to have them with us for that year or so.
Absolutely. And, I think about sometimes I'm asked from community sites, well, do you think, a student would be a good option for us to train and be a facilitator? And I'm like, absolutely, as long as they're willing to make the year commitment, right? So we do have that. I know whether it's our local program or on the L.Y.G.H.T program, that we ask folks to make a year commitment minimum, and hopefully they'll want to stay on and do that. So that's really interesting. And then you talked about like the mutual benefit. I'd love just to kind of shift into that a bit, because I think about, so with L.Y.G.H.T, and sorry for folks who aren't familiar with that, that's listening and led by youth in foster care, grief, hope, and transitions. And if you're interested in learning more about it, it's at www.dougy.org/L.Y.G.H.T, which is spelled L-Y-G-H-T. But, with the with the program, our deliverable is to provide a peer grief support program for youth in the foster care system. Well, as we know, folks, our youth come into the program and they're talking about loss and grief, but other things may emerge, right? It could be a young adult who is preparing for college and wanting to fill out college applications. And this emerges in might emerge in a light group. And of course, we're facilitating about loss and grief, and that might be embedded within it about, loss of transition and all of these things. But ultimately, our job isn't to help develop college applications. And so we definitely want to have those supports in place so that when something arises in group that we can't deliver, that we have those partnerships. And I think about, we have a lot of independent living staff who this is their calling, this is what they do. And, it might not obviously come up in group, but afterwards we connect the participant with that support person to say, I know you talked a bit about this during group. And, although that's not our area of expertise, here's the person that can help you out with that. So I know we have some other examples of the way that we have, mutual connections to serve populations that are within our relevant expertise.
Yeah, I mean, I think I can think of a couple of different examples of local relationships that we have where their model is really designed to act fast. And so our Dougy Center, staffing and model, we can certainly, respond in a timely manner, but we're also not a 24-hour, 7-day-a-week crisis service. And so if something like that has come up and we're called upon, we can kind of look within our own resources. And if it extends beyond our resources, we also know that there are other agencies that we're partnered with and that we trust and know what they deliver so that we can really refer to them and also know that they're going to refer back to us. So we kind of know each other's roles and levels of expertise and can fill in for each other a little bit so that we don't have to be the provider who does everything, right? Because none of us can. We really need those partnerships to complement each other and just, deliver the services that where there's holes.
Absolutely. Yeah. And I think about, in our local community, and I also think about even with the L.Y.G.H.T program, it's just, sometimes we're asked for things that go beyond what our focus is. And, sometimes they're like, oh, okay, maybe I can try and expand it to do this and this. And I'm like, Monique, what's the mission? Right? Like, this is the mission. And so stay focused on the mission and then recognizing. So it's not that other things aren't important to us, but it's like, if it doesn't fall within our mission, it does fall into someone else's mission. So how do we help to align that and make those connections and those partnerships so everybody is able to, meet what they've kind of signed up to do, and they have hired the staff that are experts and have the awareness of whatever it is that gap needs to be filled.
Yeah, absolutely. I mean, I think it's actually, most ethical and responsible for us, right? Not to try to stretch and make that area where it's not our expertise or we're not fully equipped. If we're able to really have, again, just those trusting relationships where we can hand it off and know that it will be taken care of in an excellent manner, then, that is the best outcome for our kids and families. So that's ideal really for everyone involved.
Yeah. And it reminds me, I used to teach a course on the core values and ethics of social work. And one of the core values of social work is competence. And what that really means is know your lane, right? So don't try and take on something if it comes across your, your table or, comes across your way because you really want to help, but it's not within your area of expertise. That's actually, like you said, unethical and not helpful. So find the person who is trained in that and is an expert in that, and then refer and make those connections.
Yeah, absolutely.
Mm-hmm.
What do you think kind of works the best in partnerships? What are the areas where you've learned, where I've learned that we have successes, and other times where it's more difficult?
I would say one of the biggest lessons I've learned is just, and I know this probably sounds so obvious, but it's just so critical, is communication. It's communication. And sometimes, there's this, I don't know, maybe a myth that you can over communicate. I actually don't believe that. I think the more communication, the better. Of course, unless someone's like, hey, it's too much communication. But ultimately, like keeping people in the loop, that's a big thing that we do is like if an executive director, for example, says, I want everyone on my team who's related to L.Y.G.H.T to be in an email correspondence. It's actually become the culture of L.Y.G.H.T where like everybody is looped in, even if they're not the one who's going to respond or they're not the person that it's directed for, they're in the know, right? So that it helps the system. It's not like, oh, I didn't get that email or I didn't get that correspondence. And so I find communication is critical. And another thing that has been really helpful for us is if we're having a phone conversation or we're having a Zoom conversation, to follow up with an email that highlights the key points that were discussed or that we agreed upon so that we have it documented. You know, it's such a busy, we're all so busy, so much going on that it could be like, okay, what did I agree to? What was that? And then just to have that written correspondence in whatever way it is, can be so helpful to refer to. So I think that's one of my takeaways for successful partnerships is good, effective, and mutually respectful communication so that both parties are just kind of in that flow.
Yeah. Yeah, I'm thinking similarly. I guess it also kind of falls under the very broad communication umbrella, but just really kind of prior to entering into the partnership, really being kind of explicit about what your needs are and what you are and are not able to provide,
Yeah.
just so that we're clear up front of what we can expect from one another and what falls into those categories and not. And then also, again, doing that follow up after, you know, service delivery or, you know, any kind of interaction, like how did that work? Is there something that we need to tweak? Is there something that we need to add to our services? Are we still missing something? So just really, you know, yeah, doing that close communication, especially when you're looking between different agencies, because we don't all have the same, you know, we have a lot of shared values, probably some shared mission, but ultimately we are separate agencies that may have different practices. So just really kind of trying to align and see where we may differ if we're still able to complement one another.
Yeah.
It seems obvious, but I think it's sometimes harder in practice. You have to be really intentional about it.
Absolutely. And I, you know, two things you said, Alicia, that come to me. First is the expectations piece. I love that. I so agree with you on that. Like just laying that out, being clear with one another, because sometimes people can engage in partnerships and they have either unrealistic expectations or unclarified expectations. And then you find out down the way your partner was hoping for this. You're like, oh, wow, I had no idea that was an expectation of us, right? Or vice versa. So I think clearly sharing that. And then the other thing that you mentioned, oh goodness, it just went whoosh, but it was another piece that I thought was, oh goodness, remind me what the last part you said, because I want to come back to that.
I think I was just talking about kind of following up and checking in along the way. Is that?
I think it was, but now I just went gap. So it'll come back to me. Oh yeah, it did come. It's come back to me. It's all. Perfect. I'm not going to sing. But the piece. Another thing I've learned is like, so when you're running the same program, there's like the benefits. It's almost like one-on-one communication versus group communication. And there was, you know, when I first started running L.Y.G.H.T and we were doing it at different community sites, and I thought, oh, okay, we can kind of do a group process meeting. And I brought in different community sites and we had allocated. So time management is also for me very important with and respecting of time in partnerships. So I had this 1 hour and I had, you know, these different sites on, and it became very clear to me quickly the pros and the cons to this kind of meeting style. So the pros to it was that we were able to listen to different things that were happening at the sites where it was like, oh, that's happening for you too. Oh, wow. Well, how are you handling it? So there was that peer-to-peer kind of mentorship. But on the flip side, it was like there was things that were unique to that site specifically that they really needed time to unpack. And within the time, and it wasn't necessarily relevant to the site because whatever the dynamics of the site or just different makeup at the site, it was just like, oh. And so one of the other things I've recognized with community partnerships is to know when we need to come together as, you know, multiple community, like you said, different communities have different needs and missions. Like, when do we come together in multiple community organizations to have conversations and brainstorm? And when is it more advantageous to provide that one-on-one support to one another? Because we can't do it all. And sometimes without the proper time allocation, it ends up falling flat when it could have been done differently. So it's one of the other things I've learned in the process of unfolding in terms of community partnerships.
Yeah, that makes me think of just kind of allocating the time of just how busy we all are. And I think, you know, whether you're looking at child welfare or, you know, nonprofit services or education or any of us, we're all so very busy.
Yeah.
And oftentimes with that busyness can sometimes come, you know, a little less patient or whatever. So just trying to keep reminding yourself that, again, we're all trying to do our best with likely limited resources and just a lot going on. So really just keeping that positive intent with partners when things aren't quite going as smooth as we'd love it to go, but just kind of returning back to why we're in this partnership and, you know, how we can improve together. I think I've seen sometimes kind of losing that patience, and that's, you know, never helpful for the outcome. So just trying to keep in that positive grace as much as possible.
Yeah. And I love talking to you because you always get things to go, oh yeah, like the light bulbs go off. But I think, you know, with that empathy, you're talking a little bit around empathy. And I think also with schedules. So I don't think, so, you know, we talked about things that can be helpful. And I imagine if those aren't there, then that means things can be unhelpful. But one of the things that I think could be helpful, and if it doesn't exist is unhelpful, is when one community partner doesn't take into consideration the other. Like, for example, if I were to go to a community partner and say, you know, this is when things need to be done, right? And I just project that, and I'm not even by any stretch of the imagination taking into consideration what's on their end and on what's their schedule and what their availability is, that can be detrimental to partnerships. And so I'm always in my dialogue being like, okay, here's my windows. What are your windows? And let's see where we can find mutual windows so that neither of us are feeling conflicted. Or, you know, what's on, this often happens, like they're like, hey, Monique, a community site, maybe like, this week we're doing a big event or we're doing this. And I'm like, thanks for letting me know. Let's schedule it for after that. Let's not put additional stress on you. Like, those kinds of communications can be so helpful because it's showing that mutual respect that we're all busy. We all have deliverables, and we're not like trying to impose like our schedule is more important than somebody else's schedule, if that makes sense.
Yeah, absolutely. I've definitely been on the other end of that and appreciate so much when people, you know, just kind of give lead up time or flexibility, or, you know, again, it's communication, just you know, clearing of all the things that are going on, and so that they're respectful of that expectation as well.
And I would say another thing that comes to mind is with that scheduling too is the grace, and not like anyone who's watching this community partner, if I've ever done this, you know, you let me know, but I feel like I've never done it. But it's like, I'm very mindful of not giving something to someone and asking for like a day turnaround. You know what I mean? Like, I'm really mindful. I plan ahead, and I'm like, hey, so like in a month, this is kind of where we're going to be. And we can't always do that. Sometimes crises happen and it's like, you know what I mean? Like, we got to get this done now. But more often than not, when you can be preventative and being intentional about planning ahead and knowing, hey, this is coming up, let's work toward it. I think it provides, at least from my experience with partners, like a deeper respect and bond, because it's like you're recognizing, like, you would hate to be the person that when your name appears on the email or whatnot, they're like, oh gosh, you know, it's going to be another emergency, and I have to respond immediately. And I have found that, and I mean, in the child welfare system, a lot of the times things can come up that it's so like crisis oriented, that like unexpected. So you have to have that gracefulness and that flexibility. And at the same time, I don't want to be the cause of that. So if it's something that is preventable, I really try to be intentional around planning, scheduling, scheduling, giving enough notice, and not just like throwing something at a community partner and saying, can you bring this back in 24 hours, you know?
Yeah, well, and on the receiving end, that makes me want to engage in a partnership further, right?
Yeah.
Just experiencing that that level of care is so mutually beneficial.
Yeah, definitely. Absolutely. I'm looking at time. We've got just a few more minutes.
Oh, wow.
I'm trying to think, Alicia, you know, with the value of community partnerships, do you have an example? I know we've talked about, you know, specifics, but, you know, we don't necessarily have to identify partners, but like something that someone's done for us at Dougy Center, or that we've done that has worked really well. An example around that by any chance?
Yeah, I mean, I can think of so many different areas of partnerships that we have, but I really love just really thinking about our local schools, of how we're able to, you know, partner with them kind of in general to provide training if they need it, to provide community response if they're looking for that, to partner with them to help support their kids and families that attend their school. And that they really rely on us and kind of refer back to us when they know that they have a child who's grieving in their school, or a need that arises in our area. And so it's just a really nice relationship where we can have great communication and connect with one another. And it's really helpful to all of us involved.
Yeah, definitely. I think I just love those, you know, those warm and just so productive relationships. And, you know, sometimes things aren't always going to be smooth, you know, and I also respect, you know, when there is a conflict and a community partner can, or I, or whoever, you know, can openly say, hey, here's a challenge we're experiencing. You know, we understand that there's going to be challenges. And so how do we work through this together? How do we bring like a positive, both intentional for that? And I also have that experience where, you know, I've called a community partner and, you know, something happened with a research study and I was like, what do I do? And I called an executive director and I was like, look, here's the situation I'm in. And, you know, the executive director was like, I'm on it. I got it. You know, and it was just like, thank you so much, you know, like, and it was like, she didn't need to do that. Like, it was not, and it wasn't an emergency. It wasn't like, hey, can you do this immediately? But it was like, hey, here's a situation that I'm in. Do you think you could help out in any way in terms of like, you know, extending partnerships or those types of things? And she was like, I hear it, Monique, I'm on it. And it just felt so good to have that kind of like, it truly feels like a partnership, like a team, like we're in this together. We want the best outcome. In this case, for youth in the foster care system, we want them to have access to this program. And so we really, even though we work for different organizations, we are on the same team. And that just feels really, really great.
Yeah, that support is really awesome. It makes everybody's jobs so much easier.
Yeah, definitely. Oh my goodness, Alicia. Well, we're at our time. Any last thoughts before we end?
It was nice talking with you. I feel like we could probably go on and on. Maybe we'll do another one of these.
Yeah, definitely. Well, thank you so much. For those of you who are watching, thanks so much, and have a great day, and we'll see you again in another episode.